research group has been very active in studying genetic patterns associated with African ancestry that might be related to this higher risk of triple-negative breast cancer that we see in African American women. And this work has led us to not only compare the breast cancers that we see in African American women compared to white American women, but it has also led us to perform international studies where we are looking at the breast cancer burden of women from different regions of Africa. Currently, we are studying the breast cancer burden of women from Ghana, representing sub-Saharan West Africa, and also the breast cancer burden of women from Ethiopia, representing East Africa. And we see some very interesting provocative patterns. The majority of the breast cancers that we've evaluated from women in Ghana are triple negative. And this is similar to the higher rates of triple negative breast cancer that we see in African American women. In contrast, however, the frequency of triple-negative breast cancer in women from Ethiopia, representing East Africa, is relatively low. It's more similar to the frequency of triple-negative breast cancer that we see in white American women and in European women. So we believe that this is further support for the possibility that there are certain patterns of African ancestry genetically that predispose for triple-negative breast cancer. African American women are actually more likely to have shared ancestry with Ghanaian women because the transatlantic slave trade from the colonial era largely brought Africans from Western Sub-Saharan Africa, including the contemporary region of Ghana, over to the Americas. But the slave trade from East Africa largely resulted in forced population migration further eastward to the Mideast and to Asia. And so as African Americans, we simply have more shared ancestry with Western Sub-Saharan Africa compared to East Africa. And so we are working very hard to try to identify whether there is a genetic signature, basically, associated with Western Sub-Saharan Africa that can predispose women to developing triple-negative breast cancer.